purpose of this CD is to provide the first semester nursing student with guidelines in performing a basic health assessment. That is a required skill to demonstrate in the clinical area. A health assessment and examination is one of the many tools that nurses use to monitor a patient's health. It is also included in the initial step of the nursing process. The purpose of the health assessment is to gather baseline data about the patient's health, supplement, confirm, or refute data gathered in the nursing history, confirm and identify nursing diagnoses, make crucial judgments about the patient's changing health status and management, evaluate the physiologic outcomes of medical and nursing interventions. The techniques used in performing an assessment are inspection, using the process of observation, palpation and percussion, using the process of touch, auscultation, using the process of listening with a stethoscope. Staff nurses use 3 of the 4 techniques in the clinical setting: inspection, auscultation, and palpation. More often than not, percussion is used by the advanced practice nurse, a nurse practitioner, during an examination. After viewing this CD, the student will be able to perform a basic health assessment incorporating all of the following: maintaining patient privacy and confidentiality, maintaining infection control measures when indicated, assessing and maintaining pain control measures, performing his or her assessment in an organized fashion, utilizing the assessment techniques of inspection, palpation, and auscultation. 2, 1. When planning to perform a physical assessment, the nurse should prepare the environment, equipment, and patient to ensure a smooth examination with few interruptions. A disorganized exam can not only cause errors and incomplete data gathering, but also instill fear and lack of confidence in the nurse's ability. In preparation, the student will gather data from the patient's history, all pertinent information and equipment: stethoscope, tongue blade, and pen light. The nurse will wash her hands. The nurse will greet the patient respectfully and identify herself.
Good morning, my name is Fern. I'll be your student nurse today.
Identify the client by asking her name, checking ID band, and other means of identification.
Can you tell me your name?
Leona.
Ensure and provide for adequate lighting, wear gloves, and provide for privacy.
Leona, let me close the curtain and provide some privacy for you. Thank you.
Cool. She begins her assessment. She performs a general inspection, making note of the client's overall development, sex, age, race, and any signs of distress.
Are you in any pain?
No, I'm feeling fine.
Okay. Raise the head of your bed. Today I'm going to do a little minute checkup on you. Okay. I already asked you what your name is. Can you tell me what the date is today?
Friday.
Okay. Can you tell me where you are?
In the hospital.
Okay, during my minute exam, I want to make sure if you have any pain at all during the assessment, let me know, okay?
There are key points to this exam. First, as the student begins her assessment, she starts from the top and then will proceed down the patient's body. This is called cephalocaudal approach, head to toe. Secondly, the examination of the integument system is integrated throughout the assessment. She will inspect the hair for color, texture, and distribution. Ears for symmetry, color, and discharge, and use of any assistive devices like a hearing aid. Face and nose for symmetry. She will also inspect the overall condition of the eyes by pulling down the lower lids, inspecting the conjunctiva for redness and discharge. Done? Let it go. Student is inspecting the pupils for symmetry and reaction to light and extraocular movements.
Okay. I want you to look straight at me. I'm going to be flashing this little light to your eyes. Just keep looking straight at me.
Direct, consensual.
Okay, I want you to follow my pen with just your eyes. Very good.
The student is inspecting the patient's nose for redness and discharge. She is also testing for patency.
Breathe for me. One more time. Okay.
She will then proceed to the mouth to assess the overall hygiene and hydration of the patient. At this time, she can assess the symmetry of the facial muscles, swallowing, and gag reflex.
Swallow.
2, 1. She will palpate the superficial lymph nodes starting at the preauricular, postauricular, occipital, posterior cervical, anterior cervical, tonsillar, submandibular, submental, and supraclavicular. She can at this time inspect the skin of the neck, arms. She's checking for skin turgor and capillary refill. She will palpate the carotid arteries, brachial arteries, and radial arteries. She'll also check the range of motion of the neck.
Look to the left, look to the right. Change your chest, put your head back. Look this ear to this shoulder, this ear to this shoulder. Okay, very good.
When assessing the respiratory system, the nurse should inspect and note the general appearance of the anterior chest, posture, breathing, and effort. When palpating, she should first warm her hands. She will use the palmar surface of her fingers, starting at the top and moving downward, assessing the chest for thoracic muscle, tenderness, bulges, and symmetry, comparing one side to the other. Upon auscultation, she will auscultate the apices, the upper lobes, the middle lobes, and the lower lobes. Assessment of the breath sound should be in 8 to 10 areas of the thorax. When assessing the posterior thorax, the technique is the same as the anterior. She's inspected for symmetry. She's now palpating for thoracic muscle tenderness and chest expansion. Auscultation at the apices, the upper lobes, the middle lobes, and the lower lobes. Assessment of the breath sounds should be in 8 to 10 areas of the thorax. 1. When assessing the cardiac system, the nurse will use the diaphragm and the bell of the stethoscope. Inspection of the heart, the nurse will inspect the anterior chest for contours, pulsations, lifts, and heaves. When palpating the precordium for pulsations, thrills, lifts, and heaves, she will use the palmar surface of her hands and her finger pads. Supine position is preferred, but for the purpose of this demonstration, semi-Fowler's is used. Palpation should be systematic from the base of the heart to the apex. The nurse must palpate the apex of the heart at the 5th intercostal space, mid-clavicular line. This is the point of maximum impulse, or the PMI. When assessing heart sounds, 4 areas will be auscultated. The aortic at the 2nd intercostal space, right sternal border. The pulmonic at the 2nd intercostal space, left sternal border. The tricuspid at the 4th intercostal space, left sternal border. And finally, the mitral area, or the apical pulse, at the 5th intercostal space, mid-clavicular line. At this time, the student will turn her stethoscope to the bell and reverse the order. The student should listen to the heart sounds, noting its rhythm, for at least 10 to 15 seconds.
When assessing the GI system, techniques to be used are inspection, auscultation, and palpation. Inspection requires noting the abdomen for skin color, surface characteristic, scars, and contours. Auscultation requires that the student move in an organized manner, starting at the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, listening at each side for 5 to 15 seconds. Palpation is done lightly, assessing for tenderness, muscle tone, and masses with warmed hands. When assessing the neuromuscular system, the nurse will inspect for symmetry, atrophy, sensation, range of motion, and strength of the upper and lower extremities. The nurse now assesses the peripheral pulses of the lower extremities, the popliteal, the dorsalis pedis, and posterior tibial. Muscle strength can be tested by plantar flexion and extension. The nurse has the patient stand and walk a short distance while observing for the gait, balance, and coordination. You have just viewed the basic health assessment for the first semester nursing student. As a review, the nurse will always maintain patient privacy and confidentiality, maintain infection control measures when indicated, assess and maintain pain control measures, perform his or her assessment in an organized fashion, traditionally from head to toe, utilize the assessment technique of inspection, palpation, auscultation, except when assessing the abdomen, which uses inspection, auscultation, and palpation.